This video will cover paroxysmal cold hemoglobinuria, an immune hemolytic disease that may lead to red blood cell disease. Let's anchor ourselves. The cold and snowy setting with the yellow pond filled with red circular buoys should anchor us to paroxysmal cold hemoglobinuria. Starting with a kid who looks like he has a cold of some sort, this represents the fact that this disease affects primarily children with viral illnesses. Of note, the most well-known are measles, mumps, chickenpox, and infectious mono. The disease presents with paroxysmal episodes associated with cold exposure. This is represented by the fact that the kid is staying safely in the house to avoid cold exposure. As you may imagine, these episodes include fever, back pain, abdominal pain, and hemoglobinuria. See that newt eating a cherry? This represents a characteristic peripheral blood smear finding of intraneutrophilic hemophagocytosis. Pretty self-explanatory, the newt eating what looks like a red blood cell. What does the letter P on his sweater represent, though? Well, it represents the mediator for this disease, which is anti-P, an IgG antibody that is biphasic, meaning that it binds to red blood cells at low temperatures and then upon warming it triggers complement to cause intravascular hemolysis. Of note, this antibody is also known as Doneth-Landsteiner antibody. If you want, you can say the kid's name is Donald and remember it that way. See the mom preparing a bag of red liquid that looks a lot like a bag of packed red blood cells used for transfusion? This represents transfusion of pre-warmed blood, a commonly used treatment for these patients. It's important to note that these transfusions should only be given as actual treatment and not prophylaxis, since any transfusion carries with it risks. Lastly, look at the dad. He looks pretty positive about the situation. He's wearing a sweater that says C3. This represents that the monospecific DAT test for anti-C3 will likely be positive. Doesn't DAT sound like dad, dat, and dad? As an extra, the monospecific DAT or DAT test for anti-IgG is expected to be negative and the polyspecific DAT is expected to be positive.